Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to FNHMA@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
From the beautiful territory of the Mississaugas of the Credit, the Huron, the Wendat, we are delighted to be broadcasting in Toronto, and we're at the NationTalk studio. My name is Marion Crow. I am a Pie Pod princess from Treaty 4 territory in Saskatchewan, but more importantly, I'm the Chief Executive Officer of the First Nations Health Managers Association, where we bring you weekly credible and reliable information on COVID-19. I am delighted and excited to give a big, heartfelt thank you to all of the frontline workers, but especially those nurses. It's National Nurses Week, and I hope you feel the love, support, and appreciation for everything that you are doing, whether you're in the community, at a hospital, at the health center, working as a public servant. Know that we love and appreciate you. We feel your exhaustion, and we want to bring light and love and wrap you in love during this time, but every day. If you are a nurse, you answer the call, and we so appreciate that. And to our hardworking health managers and directors across beautiful Turtle Island, thank you for keeping us safe, protected, and informed during this global pandemic. We have such an exciting show for you today again. I think you all know the drill by now, but we are broadcasting via the internet right now. It's 1 o'clock Eastern Daylight Time, and you can catch this, as you already are, on APTN, FNHMA, ihtoday.ca. And don't forget, if you have a question, send those in to FNHMA@ihtoday.ca. This is a two-way dialogue, and if you don't have a question for these panelists today, which I'm sure you will, we'll make sure to get that question to another guest should you so choose. So please, I want to thank you.
Do we have?
I want to thank you for welcoming us into your territories and nations. And with that, let's call in the gorgeous and informed, my fellow vaccination geek, Kim Daly. Come on into the crow's nest, Kim.
That's a new term you have this time, Marion. I love it. Thanks for having me back. Again, my name's Kim Daly. I'm Senior Nurse Manager here at Communicable Disease Control Division with First Nations Inuit Health Branch. I'm joining you today on a sunny day in the traditional unceded territory of Algonquin and Anishinaabe people. I'm delighted to join you again here. And I'm here to share some epi data. So it is Nurses Week. Thanks for that acknowledgement. It's so important to us. Marion had the privilege of talking to one of my best friends who's working in the ICU and hearing the exhaustion in her voice. I know we can keep going, and I know that vaccine is part of that solution. And so some of this news is really great news on how well we've been doing with vaccinating in our communities. So I'm excited to get to that. I have exciting news about amounts of vaccines that are coming in, and then I have some answers to some of those questions, that I'm sure everybody's looking for. What about AstraZeneca? Do we have enough Pfizer? What about the ages? So I'll just roll through that now for you, and hopefully it's not too much of sometimes data is data, but I think it's really great data that we can report on. So to start with, our forecasted allocation of COVID-19 vaccines to provinces and territories, Moderna, the week of May 10th, is 1,046,400 doses. Pfizer is almost double that, so that's encouraging. For the week of May 10th is 2,025,270 doses. AstraZeneca, the week of April 5th was the last time we had an update, and it was 316 doses. So that's something I'll speak to you a little bit later, but that is where the AstraZeneca, some of the issues are having with getting our deliveries in with that. So we will speak to some of the provinces who are no longer offering it as a first dose and some of those rationale behind that. So I want to get into our really good news story as to, what that looks like in our communities for each of the provinces and territories. So overall, the 597 First Nations communities, the communities, all 597 communities are offering vaccinations. So that's a really great success story. So the number of doses administered, both first and second, I should have a drum roll here because I'm really excited to tell you 274,449. That's really excellent. With some of the challenges we have with this vaccine and some of the challenges we have with the getting it into communities, and some of the challenges we have with some of the confidence. But our communities have really been answering that call. We talk about nurses answering the call, but when we came with the vaccines, people have been lining up and waiting their turn and coming and getting it. And that means a total of 65.6% have at least one dose. We're really going for the second dose, and we can speak to that a little bit more too. There's some good data on if we can move those doses together, and some of the provinces have started that work, and I'm excited for that as well. So the second dose, of course, has been offered some places 4 months, so that's a little harder for us to capture. But the second dose is around 71,000, which I'm trying to look at my numbers here, is 20% of the population. So that some of that speaks to some people are really eager to get their first dose and then maybe missing the mark in the second dose. So just a reminder out there, don't forget about that second dose. And when it's offered to you, please go get it. And as a matter of fact, Marion and I were talking before the broadcast of her, chasing down. So don't wait for them to call you, call your public health unit and say, especially if you live in Ontario right now, they're offering that second dose 1 month later. So get onto your public health unit and make sure you get that second dose and get us closer to some kind of normalcy here. So I'm going to kind of break it down for each of the provinces. So for BC, 203 of 203 communities have immunizations underway. Number of doses administered, both first and second, is 60,636, amazing. And 18 and above who've received 2 doses is 10,000. So that's great, and we're expecting to start collecting numbers on the younger age groups as soon as they roll out. Alberta, 47 out of 47 and 36,730, both first and second doses, and the 18 plus adults who have received 2 doses is 12,000. In Saskatchewan, 82 out of 82 communities, more good news. Number of doses administered, both first and second, are 27,093. Who've received both doses is 6,612. And we know Saskatchewan is doing a more age chunk range, so that's how it kind of falls a little bit differently. So they're getting more done of the first dose, and then it takes some time to get that second dose done. So they're going in decades with that rollout. Manitoba, 63 out of 63 communities, 42,111 have been delivered both first and second doses, and that equates to 7,430 who have had both first and second doses. So they have in Manitoba moved towards more of a prioritization for fly-in communities, healthcare workers. That's how they started rolling that out. And they're starting to share data on what they're finding with some of those rollouts. So that's what's feeding into NACI and CIC to determine when that second dose should happen with certain populations. In Ontario, 129 of 129 communities You probably heard about Orange Air going in and doing the Operation Remote Immunization. They're looking at something similar for when we have to immunize the kids as well. So that's exciting. 60,000 of the first and second doses combined, and that equates to 20,195 of 18 and above who've received both doses. So that's a good amount of both vaccinations. What about Quebec? So I divide this out into the First Nations in the Inuit. So 40 out of 40 First Nations communities have received immunizations, and 14 out of 14 Inuit communities have immunizations underway. For First Nations, 30,339 in First Nations community and 9,643 in Inuit. Total for First Nations, we don't have the total for Inuit, but 9,483 have received both doses and are fully vaccinated. New Brunswick, you know, we've seen their numbers, and they're having some ongoing issues opening and closing there. They have 15 out of 15 communities immunization underway. 12,141 have both doses of doses have been released, and 4,241 have both doses. Would have been good if those numbers would have been reversed, but sorry about that. Nova Scotia, we're seeing that 13 out of their 13 communities have immunizations underway, and 2,411 doses have been released, and 657 total of both. So, oh, I'm just zipping by, sorry. Can't forget my island, PEI, 545 doses administered, and 182 have received both doses. Newfoundland, Labrador, again with First Nations and Inuit, 2,445 in First Nation community and 2,925 in Inuit communities have received either first or second, and it equates to 705 in First Nations community, 1,400 in Inuit communities have received both doses. And we can get to our territories. The territories have 29,000 of at least first or second, and that's 12,000 have completely been vaccinated. So that's, sorry, Nunavut. And Northwest Territories, 49,000 and 21,000 who have received both doses. And last but not least, for the Yukon, who had a really aggressive and good vaccine rollout, 49,000 of both doses are out there, and both doses received in 23,253. So a couple of good news stories for that. In BC, 45% of those who are eligible have received at least one dose. So people are showing up for this vaccine, and we really want that to translate into the same success story as we move on to a different age group. In BC, individuals age 49 and older can book their vaccine, and the age-based eligibility will continue to decrease in the coming days. The Blackfeet tribe in Montana shared extra doses of COVID-19 vaccines with 450 First Nation members and others in southern Alberta at a 2-day mobile vaccine clinic approved by the Tribal Administration, Canadian and United States government. And that was such, I don't know if you were able to catch that on the news, but it was such an exciting story of working together. And we're hoping to see more of that. That's going to bring us to a great success. In Manitoba, the province has committed to provide 100 doses weekly to MNC Clinic in Winnipeg. So we're excited to see that also. Manitoba is also using social media influencers to encourage vaccinations in younger population in a campaign called Protect Our People. With that, I'm also going to bring to your attention that as this age group is getting younger, we at FNHMA have started a youth working group, and I automatically discounted myself because I don't fit into the age. I know, surprising, but the lighting's really good here, but I am not in the 12 to 30-year-old age group. And we really kept that strict. We had our first brainstorming session. We had 6 very intelligent Indigenous young leaders. The future looks really bright, let me just say that. and they had some exciting ideas. I'm putting a plug out there if you know somebody, and 12 to 30. So get some of the younger ones too out there and have some leadership qualities. We would like them on this working group. You can send it through Marion or myself, and we will get them on the working group. We're looking for ideas. We're looking to remove the government lens of it and have what the youth are saying they're hearing, what they need. And we're hoping to really make a difference in that age group. I believe that the youth are going to show up. I believe they're going to show us up. They're going to come for their first and second vaccination. So that's exciting. Let's get to some of those elephants in the room. What about AstraZeneca? I think the last time I talked to you, and I only changed my board because of Nursing Week, but I did have, the best vaccine is the one that's offered to you. But I still encourage you to make your informed choices with your healthcare provider. As we saw in my report, AstraZeneca is not coming as plentiful as it was before. So we are getting more Pfizer, and as Pfizer is, has opened up in the past week to 12 to 15, and the news keeps getting better. This because Nurses Week, I guess they give us lots of gifts. It's stable to move it in the same range that Moderna. Moderna was the one for the North, you might recall at the beginning, because it was -20. Well, Pfizer is now able to do that. And inside note, they put in an application to have it at the normal refrigeration stability. So that should be coming in the coming weeks. So that's something to be excited about. And 2 million versus 1 million of the Moderna, we're going to get more Pfizer in there. I've never really encouraged name brand shopping. I joke with people who talk about it. Do you really know if you got the same hepatitis shot for all three of your? No, you don't. You got what you got, and you just kind of took your shot, right? So I had to move between provinces when I got my hep shots. I don't know if I got the same brand name. So just keeping that in mind. We're letting our experts do the job. We do know new information is coming in. So Ontario and Alberta have pulled back on giving AstraZeneca as the first dose. There's conflicting information. I'll let them speak for themselves. But those who got the first dose, we don't know if they can go to mRNA vaccines. So until we do, they're trying to hold the AstraZeneca for them to receive their second dose. Well, what about the worries about these getting a reaction? If you had your first dose without the reaction, then the thought is that you you're not as likely to have that reaction for the second one. So, they feel pretty secure in that, but NACI's working hard to look at that and study that. So rest assured with that, and keep yourself informed. I've told you this every time I've been on here, but make sure you're getting good information from good sites. Right Here is a great place. FAC has some really great sites too. And then I mentioned it here, but the decision about the COVID vaccine and the time frame in between. So Ontario took a very good step towards for Indigenous population, having that number move to the 4 week like the manufacturer had advised. And that's due to risk. So we're looking at epi. So if you're in a province where that decision hasn't been made, it's likely due to the epidemiology. So we still don't have a copious amount of vaccines to just kind of open that gate yet. But they are looking at the data, and it's encouraging when these kind of things are happening. I have been at the tables to have those discussions, looking at the data, and I can say that discussions are underway with other provinces as well. And then I need you to do your part. If you find out that second dose is available to you, please go get it. Please run get it. Pretend you're getting free tickets to go see. I think Genesis is coming, has a scheduled concert. So pretend you're running to get those tickets. Go get your second vaccine. We did a really good job getting our first. Please go get your second vaccine. That's all I want for Nurses Week, is for people to get their second vaccine. And last but not least, we're talking about COVID vaccine. When we first released it, COVID vaccine could only be given on its own. And that was just so we could study what the side effects are. So NACI is going to come out with some statements regarding whether we can give COVID vaccine with other vaccines. So what that means is, we know the flu season's coming up. If we're due for our second dose, then can I get the flu shot and the COVID vaccine at the same time, like we do other vaccines? So that should be coming out soon. And for kids going back to school, sometimes they're due for another shot. Can we, start to make this more efficient? That's it for me, Marion. Thanks for allowing me the time.
Kim, you brought so much good news. Thank you so much. I really appreciate that. I know everyone who's listening and watching is celebrating our nurses again. So thank you. Now, as Kim mentioned, if you know of an outstanding youth member, please get in touch with us and you can send that suggestion to FNHMA at ihtoday.ca, and I'll make sure that Kim gets those names that you put forward. And again, if you have a question, go on into the inbox, FNHMA at ihtoday.ca. Well, let's transition now from our wonderful nurse to an outstanding leader. You know who's coming, Chief Allen. If you want to unmute yourself and come on into the crow's nest, we'd love to hear and learn from your experiences at Constance Lake, how you've responded to COVID-19 and some of those challenges. Chief Allen, over to you.
Thank you for having me on your show here. It's a privilege and an honor to be here to share our story here from Constance Lake First Nations, because I know we had our highs, we had our lows with our First Nation. I know sometimes we're labeled as remote or road access, but we're all First Nation communities that still have the same issues that the remotes have. The road access have. I know we all have lack of housing. We all have lack of infrastructure. We all have the same issues that every community has. And then to top this off and to deal with a global pandemic was something else. Sometimes when you step into a leadership role, you expect to do changes for your community, but then that time has changed when you have to step up and deal with something greater than these issues, because you're dealing with the health and safety of your community members, your youth, your elders. You have different challenges that are brought upon leadership. But then at this time, first of all, I'd like to thank all the nurses across Ontario, across Canada. Even our nurses that work for our First Nations that come in, they're the ones that do the frontline work. They're the ones that put themselves at risk. And also I want to acknowledge my community teams that were involved in this whole situation, from my staff, all the ones that participated in giving out food hampers, manning the checkpoints, managing all these lockdowns. I know this is part of the process of working with the unknown, this global pandemic. When it first was established here in March of 2020, this was something new that every community, every leader, every nurse, every nursing station that's evolved around every First Nation had to deal with. And how do you deal with something like that? There's no book, there's no set of rules. We only had each other as a nation, as a First Nation. We had partnerships with our other First Nations to deal and how we move forward and keeping the community safe. As I said, there were highs and then there were lows. Some of the highs is that, we acknowledged to keep the virus out at a certain time, to keep our community safe, keeping our elders. That was a high, but there also came a lot of lows. I know our community members not liking to be locked down in the community, not being able to go and do the things that we normally do, that we're accustomed to. Where you can just pick up, drive, go to the grocery store. That was all set aside, just for the safety. And this is what kind of the hardships that leadership had to deal with. Not even leadership, just our community members, our youth. We're not allowed to be playing. I have a daughter here that cannot play with her own friends. That's kind of challenging. But then there's as I said, there's a lot of highs and a lot of lows. And then the biggest low was when every leader in their community says, I hope the virus isn't coming to the community. And okay, come January 2021, we had our first positive case. And then this kept escalating to a number where we thought it would never go away. But then with the hard work of our staff, our health center, is participated in this whole ordeal, our tribal councils and everybody stepping up to support a nation that's in trouble, but then with all this knowledge that we got, we shared with other First Nations and how we coped and dealt with these issues. It's like I don't wish this upon any First Nation or any municipality that we have to go through these trying times of having a virus in the community, and you worry, you get sleepless nights worrying about your elders. Our elders were impacted. We had positive elders. We had positives that were hit in our school. It's unknown. That's the biggest problem here. It was unknown how it spreads, when it's going to come. But we had that date. But then we survived. We survived and we triumphed this whole situation. But there are still days that are tiring. That we still worry about the virus coming in. And that's why we still operate a checkpoint of not allowing our relatives from out of town, people coming in, services that are coming in, you try to advance your community, but then you have to really look at the safety of how to advance, like as I said, your political platforms that you put going forward as a chief or as a councillor in times, that's thrown out the window because your main mandate right now is to address the health and safety of the community and ensuring that it stays that way. Sometimes it's difficult, to get negative feedback from your own people, positive feedback, that's the trials and errors that we work with, but you have to always acknowledge everyone in your community because they're the ones that are abiding by the checkpoint rules, the stay-at-home order. They're the ones that get the acknowledgement here because they're the ones that are following the rules and try to keep our community safe. But as I said, there's still that inadequate resources that we have. Like as everybody across Turtle Island, all the First Nations have the lack of housing. We have the lack of nurses. We have the lack of everything. And top that off, we have to deal with this global pandemic. And this is things that we constantly work with every day. And then going into an election, there's these things that you have to deal with. And then sometimes you may be rated on this, but at this time, I don't worry about what's going to happen at the next election. You still have to worry about the day of the election coming in, dealing with the safety of everyone. And it's just a bunch of highs and a bunch of lows. But as I said, I think with the support of everyone that stepped forward, I have to always acknowledge my staff, my health center, my health team, the nurses that came, all the vaccinators that came here. That was a big issue. That just came to something that we were wondering why. The biggest low we had was when we were in trouble with the positives in our community. We're saying we need the vaccines because the remote communities were always first on the priority line. But then when we speak about being susceptible to the virus coming into our community because we're road access. But then, every community faced that, even if you were remote or your road access, everybody got impacted in some way or fashion. Sometimes you speak of things that are negative. Sometimes you let anger speak on and saying, oh, we need these vaccines. You get mad, right? But now our community has endured their first shots. But then sometimes you got to worry about what social media says and what it implants in our community members that refuse to take it. But you still have to encourage your members to take the vaccination, regardless of what social media says or what the news says. And this was a challenge for us through the first round of vaccinations that came into the community. It was a trying time because, as I said, we're rated either a remote or a road access, but that's all forgiven now. We got the vaccinations rolling into communities. It was an honor from the government to recognize First Nation communities that we do need the vaccines. And they see the lack of housing, the lack of infrastructure, education, it all rolls on. This is child care and everything, education. But then that now it's fixed. But now we got to get everybody on board and get some positive news that the vaccine is safe, because there's some beliefs that it's a tracking device. All the negative flag that's out there, we have to get that out. But now I recommend that every community that's out there ask the communities to get vaccinated. Don't beg them. It's everybody's choice. But to see at the end of the tunnel, there is that light as you see things moving forward. But you have to always worry. I hear government speaking about recovery, economic recovery. But we also all have to look at I just lost my train of thought here, but then you have to look at the end of the tunnel when you have to take the aftermath. That's the word I'm looking at, the aftermath of what's going to happen. Because what's going to happen to the children that have the lack of education? What's going to happen with all the mental health? This is what the government should be looking at in reality, because everybody suffered through this whole global pandemic at this time. But that's what the next phase should be in dealing with the mental health issues. The light at the end of the tunnel is there, but there's still that aftermath that we have to deal with. And I think every community should set up that way. Government should support this initiative, because resources will be there. Economic recovery will happen. So for right now, we just have to worry about the aftermath and take care of each other, take care of our country, take care of our province, take care of our nations. And then at the end of the tunnel, we'll be back to where we were. But then this should be a wake-up call to everyone across Canada, across the world. This is just the tip of the iceberg of being prepared. We're supposed to, what if the next virus is even deadlier? What if something else happens? I think this is a wake-up call to everyone in the world that we have to unite and share our resources and share how we get better and how we protect each other going forward. But again, I'd like to thank you guys for listening to our story here in Constance Lake First Nation. If you do want to see some of the results that happen in our First Nation, feel free to email me or contact me in Constance Lake First Nation, and I'll be glad to share my story with you all. But at the end of the day, the light of the tunnel is getting bigger. Let's get everybody vaccinated, and let's get back to the normal way of life. Be good.
Chief Allen, spoken like a true humble leader, offering all of that gratitude and passing on the acknowledgement to your nation's members and to your staff and employees. My goodness, thank you so, so much for being the advocate, the voice, and for reminding us there is light at the end of the tunnel. I think we all need those messages of hope and resiliency every once in a while. So thank you again, Chief Allen. I do want to say thank you to our viewers and listeners who are tuning in as well. Brad, thank you. Holly, we see you. Appreciate that this is where you are getting that credible, reliable information regarding COVID-19. And let's all do our part in fact-checking and not spreading misinformation at this time. So now we are rounding out the panel. Last but certainly not least, a good friend, Tabitha Bull, who is the CEO and president of the Canadian Council for Aboriginal Business. Tabitha, your turn in the crow's nest. Come on in.
Thank you, Marion. Miigwech to everyone, and to Kim for all your work you're doing and your announcements and keeping up to track. It's so interesting. And Chief Allen, we met in a different career of mine, but all of my gratitude to you for the work that you are doing and leaders across this country. I just lead a business. I can't imagine leading a community through what we've gone through in the last year and a bit. So thank you so much, Chief Allen, for your hard work and commitment to your community. And Marion, it has been an incredible year and a bit getting to know you through this pandemic and understanding how we at CCAB can support communities and Indigenous businesses through this work and this year. I will talk a little bit about specifically on PPE and what we've seen Indigenous businesses be able to do to provide PPE. I just want to talk a little bit before that on what we're seeing the impact of COVID on Indigenous business. And our role at CCAB is really to ensure that we're continuing to support the growing numbers of Indigenous businesses across the country and understanding how we can support them through government programs, ensuring the government programs meet the needs of Indigenous businesses, that they're eligible for them, and also just trying to, as you said, get that fact-based information to businesses at how they can manage through this period. Before COVID, the Indigenous economy was on an unprecedented growth. As of 2016 census, there were over 60,000 self-employed Indigenous people across Canada, which was a 40% increase over what was reported in 2011. So we're seeing this incredible growth, and we know that Indigenous businesses employ more Indigenous people than non-Indigenous businesses. We know Indigenous businesses have a corporate, environmental, sustainable part of their business plan that is integral to all of those businesses. And we know that Indigenous businesses give back to their community and support their community, and that really creates intergenerational wealth in a community and in the youth. So we so respectful of how everybody is managing through this last year, but we've really been focusing to understand what's the impact on businesses and how can we ensure that there are supports needed. So we did two surveys over the year with NACA and NIDB and CANDO, and talked to Indigenous businesses about the impact. And we found that nearly 3/4 of Indigenous businesses had experienced a negative impact from COVID-19. Almost half of them had laid off staff temporarily or permanently due to the pandemic. And only 17% of the close to 900 that responded to the surveys said that they didn't require additional financial assistance. So we really had to work hard to ensure that the financial assistance that the federal government was providing, provincial government was providing, that Indigenous business were eligible for that. And there were some gaps, but we did, as organizations, work with the government, and they were responded to see that those gaps were met. However, we truly believe that procurement from Indigenous business and ensuring that all corporations and all levels of government are committed to procuring from Indigenous business is going to be a key to support the Indigenous economy and Indigenous communities. So at the start of the pandemic, when a call went out to all Canadians to support the fight against COVID, as always, Indigenous people and businesses were resilient and got to work to answer that call. We immediately went to our members to understand who would be able to provide PPE to answer federal government call. And about that time, I think we had about 14 of our 600 members that had products already. But we had a good percentage of businesses that were willing and wanting to pivot what they were doing to be able to provide hand sanitizer. So we had breweries that were pivoting to provide hand sanitizer. We had flag and uniform companies that were pivoting to provide masks and gowns. And we saw really incredible partnerships between non-Indigenous business and Indigenous business to come together to be able to answer that call for PPE. So in that same survey of close to 850 businesses that have responded, 13% of those businesses had registered with the federal government. They had a product that they were able to supply for PPE. And another 8% had reported that they were looking to scale up or to pivot what they were doing so that they could also provide supplies or equipment. And that Indigenous business capability to meet those demands was demonstrated. There was a call out specifically to Indigenous businesses to provide non-surgical masks. 233 Indigenous businesses responded to that bid. 6 businesses were awarded contracts, and they provided 15 million non-surgical masks to support federal government's PPE and then distribution out to communities. We surveyed our businesses again in December, and the number of businesses who would pivot to provide PPE had increased to 33%. So this is an incredible positive contribution to the procurement effort of PPE, but also to the communities, regardless of the size of the business. So a few really incredible stories. One, which you've probably spoken to before, Marion, is the First Nation Procurement Incorporated, who were originally buying products, imported products, but they were already here in Canada. And I'm sure Kim can speak to this too, but at the very beginning of this pandemic, there was a lot of questions about specifications and approval from Health Canada and what is the proper mask. And that was difficult for small Indigenous businesses to understand. And some had also made a large purchase or a commitment to a purchase, and then the specifications changed. So First Nations Procurement Incorporated started reaching out to manufacturers. They connected with Dentex Canada, who's a Vaughan-based company that produces digital radiology equipment. And in November, they joined together and they opened 2 manufacturing plants on Manitoulin Island, one in Sagamuk and one in Wiki. And they are producing FN95 masks, and the FN stands for First Nations. And I understand that they worked with you, Marion, and with NACA to donate 500,000 masks to communities. So that incredible story of giving back is so optimistic and so important about supporting Indigenous business. We've also seen some really great progress with Corporate Canada looking to purchase PPE specifically from Indigenous business. So one great story is Rocky Mountain House Health and Safety. They're an Indigenous business who provides PPE, and they're currently supplying PPE to Petro-Canada stations. It initially started out as a pilot program in Western Canada, but now they're launching nationwide due to the success that they had with retailers in Victoria, Vancouver, Edmonton, and Calgary. We also saw companies like BMO and Hydro One and Canada Post reach out and know that they were about to open their branches or open their offices and wanted to ensure that they were supporting Indigenous business, and they all purchased PPE from Indigenous businesses, including us at CCAB. We also purchased from Warrior Supplies, who is in Thunder Bay. BMO supported from Inish, which is out of Ottawa. It's really incredible businesses, and you see these businesses step up and give back to communities as well. So we currently have over 30 Indigenous businesses on our website that are supplying PPE. Anybody can go to that website at ccab.com and connect with any of those businesses. Their contact information is there. And we're going to continue to support those businesses in every way we can. So thank you so much again for this and for having me here. It's been a really great session. I'm open to any questions and any way I can help. So, Chimigwech.
Tabitha, that is the attitude we saw right from the beginning. Your leadership in stewarding such an unprecedented time is so appreciated and valued. Thank you for taking the calls. Thank you for profiling those Indigenous businesses and for getting your members the support they need during this time. And again, if you too want to continue, like we always do, to lift up and celebrate our resilience, because we've been through a lot. We can all agree. Step up, go to ccab.com. .com and get your PPE from an Indigenous business. Thank you so much, Tabitha, and don't go away. We will come back to you for questions in the inbox. Tabitha talked about some of the Indigenous organizations who have been ensuring that people are still employing. I know at FNHMA, we had to open up some of the channels as well in terms of getting staff in to support all the COVID communications that we were doing. And I want to continue to celebrate and call out the FNHMA family, the board, our staff members. We are so delighted to be able to have a role in protecting our nations across Turtle Island. And I want to say welcome to our interim communications director, Kim Mumford, who's watching. Welcome to the FNHMA family. She's on day 3 of her role with us. And welcome back, Owen Steele from Kitigan Zibi, who is our summer student returning to FNHMA. And for our members who are listening and watching right now on the Indigenous media partners that we have, so those radio stations, APTN, we want you to know you'll probably hear from Owen over the summer, talking to you about the town halls, talking to you about your membership and getting an overall sense of how you're doing, because we know these times in our hearts are just so with you in lifting you up. And I can't say enough of gratitude and love. And with that, I do want to cue the studio. They're in my ear. Let's now join in all of this thanks, love, and gratitude for all of the essential workers. And let's play our thank you public service announcement. Over to the studio.
To all the dedicated healthcare workers and providers on our community front lines, we thank you and owe you a debt of gratitude. We stand united as Indigenous health organizations. We support you all in your efforts. For credible information sources on COVID-19, please visit the Public Health Agency of Canada and Indigenous Services Canada websites. The partner organizations mentioned here are also trusted sources to support you. Thank you and stay safe.
We lift you up. We stand shoulder to shoulder. And I wish we could give you a break. So let's be diligent about getting the vaccination, about making sure that we're all following the public health guidelines. And we know that even if you are vaccinated, every once in a while there's a breakthrough infection. Our good friend, Dr. Shannon McDonald at the First Nation Health Authority, after receiving her her first vaccination, I apologize, did get COVID-19. So it's still really important that we wear our masks, that we wash our hands, and that we try to stay that moose length away from folks as well. So please join me in protecting you and protecting everybody else. Our cookums, our mushums, our nokomis, whatever your language is, we want to make sure that we are all back at the celebrations, wearing all of our beautiful regalia that people have been working on during these quiet times, so that when we gather again safely, everyone is back at our campfires. So with that, I do have a couple of questions. And Kim, you know the drill. I'm going to send my first question to you, Kim. So come on back in. I understand that the government stockpiles are opening up to nations. Can you tell us about what that looks like and how we can get access to the government stockpiles of PPE, etc.? Over to you, Kim.
Thanks, Marion. I can speak to PPE for sure. Other stockpiles I'm not aware of. I want to clarify really quickly, we do not have stockpiles of vaccines. So I think that's the important part. People are confused often, but that's always been provincial, territorially run. And we advocate for vaccine access to each of our communities. So PPE, there's two folds of PPE. And I think it's important, Tabitha was talking about, medical grade versus non-medical grade. And the medical grade are the ones that are really difficult to still they're readily available, but they're still counterfeit. There's still access levels. So for example, in Quebec, using an N95 mask is sometimes utilized more often than it would be in other areas. COVID-19 is still not an airborne. So it depends on what your provincial regulators are. So all First Nations, all Indigenous have access to a PPE stockpile if it's through your province or through FNHMA. So what that means is if you cannot access it through your province and it's for medical needs, we do have that. If you're looking for PPE for your essential services and businesses, etc., there's funding that's available for that. And there is also the ESCR, which we announced at our last working group. They have some PPE that is readily available, and that has gone out through channels of information. It's not a endless amount, so they're just trying to make sure that they don't have PPE that's expiring in their warehouses. So they've offered it up to Indigenous organizations first. So, depending what you're talking about, and I think everybody's learned more about PPE in this past year than they ever thought they would. But my real focus and role is for the healthcare worker standard, and Tabitha hit the nail on the head. Those standards changed. When we started opening up to dental, I couldn't believe how many levels of surgical masks there were. As a nurse in the hospital, there's a surgical mask in the N95. I didn't know there was level 1, 2, 3, and then there's kind with the eye. You name it, we've seen it, right? So medical grade, if you're supporting healthcare, so in other words, the security who are supporting our mostly nurse-run clinics, then we have opted to provide the PPE there, because we can't run these clinics on our own. As much as it's Nurses Week, we don't operate on our own, and we're happy to be parts of teams that need the same protection. So I hope that answers that question. It's quite a open-ended, but there should be no problem with accessing PPE. The only careful that you have to be is make sure you're getting the right PPE for you. So have you been to Costco and seen people with N95 masks on? As a nurse who had to wear that during SARS, those are not comfortable after 15 minutes. So I can't imagine why you would wear it, and you're more apt to wear it incorrectly because you're adjusting it so much, because it's very difficult. So make sure you're using the right PPE.
Thank you so much, Kim. Always appreciate your fellow geekiness on the enthusiasm we get when talking about epistats, vaccines, and let's keep geeking out together, Kim. There is a question for you specifically, and the question is from a person who writes in saying they live in Ontario and had 1 dose of AstraZeneca. Should they be worried? What will happen for my 2nd dose?
Yeah, great questions. So as Marion knows, many people will reach out to me, friends and family, really close to me. I have 3 children. I use air quotes. They're not little people, they're adults. And just a side note, personal story, my kids all have cardiac disease. So my son had a heart attack at 8. So I know what it is to make these difficult decisions. And I know I don't want to see him in the ICU again. So when the vaccine started coming out, he's 27. Oh, I hate to say that. That makes me old. And he's making his own life choices. So this is the question, and I shared this with you before, when I had to decide for my mother who has dementia and my son and my 2 daughters who all have the same cardiac, it was the first vaccine that we have. So, my son and I looked over, I know his medical charts inside out, and AstraZeneca would be the best for him. We still haven't got him a vaccine, so that makes me super sad. So, there's this sometimes vaccine, like some people are like, well, look, I got a vaccine, and others are like, I'm just waiting for any vaccine. I shared with you, I talked to my good friend who's an ICU nurse, and her frustration is real. And when we talk about the breakthrough infections, and there was a 20-year-old that passed this week in Ottawa, we can't keep going in this direction. And the risks of the blood clots are quite a bit higher if you do get COVID. I know we all think we won't, but if you take a day and map it out, I hold myself accountable to this. We've all had breaches. Like even when I worked in the hospital, you have a breach of your PPE of realizing, oh, I didn't practice the best there. you're exposing yourself. Even when you're trying your best, we're exposing ourselves. So I get it. So to answer your question for AstraZeneca, in Ontario, you're going to have to wait to find out. In Alberta and Saskatchewan, they are holding that for the second dose. The theory is, and the best evidence so far is, if you've had the first dose and haven't had a reaction, then the second dose will be safe. And we know better about those reactions. We're better prepared for that. So hopefully that gives you some kind of comfort. NACI is looking into, if you had a viral vector, which is what the COVID vaccine is, what the AstraZeneca vaccine is, can you get an mRNA for the second vaccine? We just don't know that yet because they're just a little bit different makeup. And I laugh out loud because, Marion, remember when I had to convince people to get the mRNA vaccine, and now we're on track of everybody wanting that. So keep informed, keep up to date. For this question, go to your your Ontario Public Health, whichever unit you're in. Keep updating and looking there. They're looking for this information and trying to get that updated as soon as possible. All signals point to they would probably get you to have your second dose with AstraZeneca, but there's really low amounts coming in right now too.
Thank you so much, Kim. Tabitha, we have a couple of moments left, and here's a question for you. How do you see Indigenous companies and entrepreneurs getting involved with post-COVID restart of the economy? What sector do you think will be the first to rebound in this fragile situation?
I think we're seeing with social justice movements and with people really starting to understand, or maybe acknowledging, the gaps that exist between Indigenous people and non in this country from a social economic point of view. We are seeing a lot of corporations really wanting to understand how they can do better, how they can support Indigenous people, Indigenous communities, Indigenous business, but we're also seeing consumers interested in purchasing from people whose values are aligned with them. And when we look at Indigenous businesses and Indigenous people, sustainability is at the core of everything we've learned. So a lot of those businesses that are using sustainable values and are looking at clean products and sustainable food, I think we're seeing a really great interest in the value of that, and in respecting Indigenous businesses are tied to that. So we're seeing a real uptake in agriculture, aquaculture, but also products, so health products. So, those women who make incredible soaps and lotions and salves that are all from the earth. We've seen a real uptake in that also. But also, just quickly, I think there is a real optimism and opportunity for partnerships with corporations and for equity partnerships to work together. And we have this conversation. Is this like us continuing to move, or are we kind of at a tipping point here? I think we're really on a good path, and we'll continue to see that increase in interest.
Thank you so much, Tabitha. I really appreciate your perspective. And I have to say, I can't believe how fast the hour goes. Just like that, we're at the conclusion, and I do just gratefully thank everybody who has been a part of the co-creation of the content that we are sharing with all of the nations across Turtle Island. So, if you have a question or a comment, please send that to FNHMA at ihtoday.ca. I want to say again, a big thank you, recognizing that it is Nurses Week. Thank you for the hard work, love, and we know you're exhausted, but know that we love and support you. Thank you to our Indigenous media partners, and don't forget, check this out on APTN. Until next time, stay safe and healthy. Hi.